Hello and welcome. Today we're diving into a complex yet crucial topic, post-LASIK ectasia. If you've ever considered or undergone LASIK surgery, understanding this potential complication is vital. We'll explore what it is, why it happens, how it's diagnosed, and what treatment options are available. Post-LASIK ectasia isn't a spontaneous condition. It develops as a consequence of LASIK surgery. The primary culprit is the weakening of the cornea's structural integrity during the procedure. LASIK creating a thin flap on the cornea, and then using a laser to reshape the underlying tissue. While this corrects refractive errors, it also reduces the cornea's overall thickness. In individuals with pre-existing but often undiagnosed corneal weaknesses, or when too much corneal tissue is removed, this thinning can lead to a progressive bulging or steepening of the cornea, ultimately resulting in ectasia. Let's delve into the pathophysiology. The cornea's strength primarily comes from its collagen fibers arranged in a precise pattern. LASIK disrupts this architecture. When the remaining corneal tissue isn't strong enough to withstand the eye's natural intraocular pressure, it begins to bulge forward, typically at the weakest point. This distortion changes the shape of the cornea from its normal rounded form to a more conical one. This irregular corneal shape distorts light entering the eye, leading to blurred vision and other visual disturbances. Determining the precise epidemiology of post-LASIK ectasia is challenging, as its occurrence may be underreported or misdiagnosed. However, estimates suggest it affects a small percentage of LASIK patients, typically less than 1%. Risk factors include high myopia, thin corneas, abnormal corneal topography suggestive of subclinical keratoconus, and younger age at the time of surgery. It's crucial to remember that while the risk is relatively low, the potential consequences are significant, highlighting the importance of thorough pre-operative screening. The signs and symptoms of post-LASIK ectasia can vary in severity, but they often include a gradual worsening of vision, even with glasses or contacts. Patients may experience increased nearsightedness, astigmatism, and difficulty seeing at night. Glare, halos around lights, and double vision are also common complaints. It's important to note that these symptoms may not appear immediately after LASIK. They can develop months or even years later. Diagnosing post-LASIK ectasia requires a comprehensive eye examination and specialized corneal imaging. A slit lamp examination can reveal subtle corneal irregularities. However, the most important diagnostic tools are corneal topography and tomography. These techniques create detailed maps of the cornea's shape and thickness, allowing doctors to identify early signs of bulging or steepening. Pentacam orbscan and optical coherence tomography (OCT) are some of the technologies commonly used for this purpose. While not strictly categorized into distinct types, post-LASIK ectasia is often described based on its severity and progression. Some cases progress rapidly, leading to significant visual impairment, while others remain relatively stable for extended periods. The location of the ectasia can also vary, influencing the specific symptoms and management strategies. Unfortunately, there's no cure for post-LASIK ectasia. The goal of treatment is to stabilize the cornea and improve vision. Options include rigid gas-permeable contact lenses, which can provide a smoother refractive surface and improve visual acuity. Corneal collagen cross-linking XXL is a procedure that strengthens the cornea by creating new bonds between collagen fibers. In more advanced cases, corneal transplants, such as deep anterior lamellar keratoplasty (DLK) or penetrating keratoplasty (AK), may be necessary to restore vision. Prevention is paramount. Thorough pre-operative screening is critical to identify individuals at risk for ectasia. This includes evaluating corneal thickness, topography, and family history. Surgeons should adhere to established guidelines for corneal tissue removal and avoid performing LASIK on patients with pre-existing corneal abnormalities. Newer surgical techniques, such as a small incision lenticule extraction, which involves less corneal disruption, may offer a lower risk of ectasia, though further research is needed. The prognosis for post-LASIK ectasia depends on the severity of the condition and the effectiveness of treatment. Early diagnosis and intervention can often stabilize the cornea and preserve vision. Continued research is focused on developing more effective treatments and preventative strategies. Recent advances include refinements in corneal cross-linking techniques and the use of femtosecond lasers to create more precise corneal flaps. Researchers are also exploring the potential of gene therapy and regenerative medicine to strengthen the cornea and prevent ectasia. Regular follow-up with your eye doctor is crucial to monitor for any changes and ensure the best possible outcome.